My name is Sean. I had a stroke 7 months ago. I had a stroke at home while my wife was away. I had some pretty severe eye pain, and I had complete right side paralysis. So I was unable to talk or use my right leg and my right arm.
When I found him, when I had gotten home, I could see he had complete right-sided paralysis and couldn't talk, couldn't move that whole side. So I immediately knew he was more than likely having a stroke, so I called 911.
I was rushed by ambulance to the hospital where they performed an EVT surgery that I was eligible for.
When Sean arrived in the emergency department, I saw him immediately, and he had weakness affecting his right side of the body. He couldn't talk clearly, and we immediately recognized that Sean was experiencing a stroke. We did the CAT scan, which showed a large clot affecting one of the arteries in the back part of the brain. Because Sean was outside that window where we can give the clot-busting medication, we decided to treat Sean with this new procedure called endovascular thrombectomy, where we go from the groin area, go all the way up to the brain and try to pull the clot out. It was a very emotional moment, not as a physician for me, but also looking at the entire family. Sean's wife was pregnant, and it was very difficult to explain that at such a young age he had such a major stroke. We immediately recognized that he needed that procedure and needs to be done as quickly as possible. We were able to successfully pull the clot out with we call it a single pass, where we suction the clot out. And as soon as the clot came out, shortly after Sean started to move his right side, his speech started to clear up. Over the next coming day or two, he started to improve, he regained his full strength, his speech cleared up. He had fantastic recovery, and we were very, very pleased with the recovery.
So I went back to work about, I think 4 months. Gonna have been full-time since 5 months after my stroke, so I'm back full-time now. And doing everything I was before my stroke, maybe even better than before my stroke.
I was 29 weeks pregnant at the time, and the whole care team was just really amazing with, especially with Sean, but also with myself. And they took the time to take care of me as well, and we just are so grateful for everyone for saving his life.
I got to be a dad and to be with Emma and meet Emma. I'd like to thank them for my life, and I think I'm learning stuff all the time about how lucky I am.
Having the availability of endovascular treatment for the treatment of acute stroke in Sudbury is groundbreaking for us and is great for the population of Northeastern Ontario.
By treating our Northeastern Ontario patients here locally in Sudbury, we are able to shorten that duration from the time their stroke started to the time we are able to successfully treat them. So they are able to get home quickly, they are able to recover better, and that translates to a better quality of life.
In February 2020, HSM began offering endovascular thrombectomy, a specialized and time-sensitive treatment to remove a stroke-causing blood clot from a person's brain. In November 2022, we performed our 100th EVT procedure, and the team continues to serve eligible stroke patients in the Northeast on a 24/7 basis.